Hello everyone, this is Dr. Joel Rosen. I'm here with a great patient of mine, Lynn, who has given me permission to talk to you today about some of her experiences in our office. So Lynn, can you just tell us why you first became a patient of ours?
Well, I became a patient because the medical treatments and all the doctors I was seeing couldn't help me. All my lab tests were fine, but I wasn't fine.
So what was the main symptoms that you were dealing with?
At that time, I had hormonal problems. I had hair loss. I had, I guess, liver problems that I didn't even know about.
Right.
A lot of pain.
And a
lot of gas.
gastrointestinal stuff. Okay, so a lot of stuff.
Yes, a lot was going on. And every time I went and had a test, all my results were normal. But then when you read the test, you found
that
they weren't as
weren't so normal.
Mm-hmm.
Okay, and that's an important point. What we do is we look at your tests a little differently in terms of you're not as sick as the average sick person,
Right.
But you're not as healthy as the average.
I could be, as I used to be, because
Right.
I know the difference.
Right,
Yeah.
Absolutely speaking. You felt
Correct.
there was something different. So as far as any concerns, did you have any concerns, fears, or trepidations before starting care with us?
No, because I went to your lecture at Tooney's, and
Right.
it all resonated with myself and my husband. We
Right.
both thought, okay. And
Right.
then we read the book on
The thyroid book?
The thyroid book.
Yeah.
If everything's fine, but you're not, there's still a problem.
Right, why do I still have thyroid
Right.
symptoms? Okay, all right, so now here we are, and you started with us in June. In June. So here we are, and it's the new year, it is January 2017, and we're doing a lot better. So tell us about some of the major improvements that you're seeing.
Well, my hormonal health is much better. I don't know, but I think my thyroid health is a little bit better because they lowered my thyroid medication to 88.
Right.
And my hair growth has come back. My hair's growing fine.
Right.
It was falling out like crazy.
Right.
But I still have a lot of gastrointestinal problems. And my weight has never been an issue.
Right. Well, that's a major thing for women that we work with is, when they're losing their hair and they're on thyroid medications, they're not getting to the root cause of some of the problems.
Correct.
They're not seeing that hair come back.
Correct.
So, all right, so that's really great. And then as far as pain, tell us a little bit about that too, because you've told me some about that.
Oh, yeah, okay, that's important.
Yeah.
Well, I had a lot of back pain from surgery, and I was taking opiates for pain patches.
Right.
So I decreased them after, I guess I started in June, because I remember when I first started seeing you, I started decreasing the pain patch quantity.
Right.
So I went from 50 mcgs all the way down to 12 to 0.
Wow.
Well, I did 25 in the middle.
Right now, all of a sudden, you worked your way down.
And I think it took about 3 months.
Right.
And now I'm completely off the opiate pain patches.
Right, and we talked about the importance of that, right?
Right, absolutely.
I mean, the liver is able to regenerate. Okay, that's great. So the last thing I would say is for anyone that's skeptical, that potentially has been told that their blood tests are normal, that that they're not getting the results they want through their traditional ways, and then they go more through a functional medicine approach, but they realize that insurance may not pay very much of it. What would you say to those people that are a little skeptical?
Well, I don't know. The value for me has been worth it.
Right.
And I know it costs money, but I think so far it's been money well spent. And
Right.
sometimes it's hard to spend the money, of course, but the results have been more than regular.
Right.
Medicine has offered me, because we spend time going to the doctor, we see the doctor, and he says there's nothing wrong with me.
Right.
They do expensive tests, they do all this kind of stuff, and there's never,
Sure.
they don't give me anything to make me better. At least here we've had a lot of
Right.
positive
Sure.
outcome.
Sure. I mean, and I
With the
think
supplements, they aren't cheap either, but they seem to be working better than pills.
right, easier on the liver.
Yeah.
I mean, your liver. If your liver can give me a testimonial, it would be saying thank you right now.
I hope so.
So I think that's what we hear a lot of, though. A lot of patients will say it depends on what your health is worth.
Mm-hmm.
If you're sick and you don't feel miserable and you're not sleeping and you can't focus and concentrate, you have a lot of pain, and you've been going to the doctor and they've been telling you you're normal.
Right.
Then obviously something's missing.
Or you're depressed. I got a lot of that. You have to be depressed because there's nothing else wrong with you.
Right, maybe just go on antidepressants.
Yes.
And that's your problem.
Yes.
You don't have enough antidepressants in you.
Right.
All right.
And then they did a cortisol test in the hospital.
Right.
And that was horrible.
And you weren't, right.
That was normal.
Yeah. Well, that's the problem. All right, well, I appreciate it. Thank you so
Okay.
much for doing this today.
Good.
Great.